Employees and patients in Oklahoma's veteran centers are part of the Phase 1 vaccination group. They're first in line. However, state officials were not happy at the rate they were receiving the vaccine, and so they made a change. Reporter Whitney Bryen with our content partner Oklahoma Watch joins us now with details on that. Whitney, the vaccine rollout has been slowed all across the country, actually, but what specifically were some of the issues encountered by Oklahoma's VA centers?
There are two entities who are vaccinating long-term care facilities. There's the state of Oklahoma, who vaccinated some of our facilities, and then there's the CVS Walgreens federal program, and they're vaccinating the rest of them, depending on where the facility signed up. The state of Oklahoma, the health department, was able to get their 177 or so facilities vaccinated pretty quickly. On the Walgreens CVS side, it took a lot longer for them to get some of the facilities scheduled and to roll it out.
And so the state just took over the program, correct?
We have more than 650 long-term care facilities altogether. Nursing homes, which make up about 250 of those, were the priority. So most of those have already received their first round and are moving on to a second round of vaccines. But when it came to the veteran centers, they had not been vaccinated. One was vaccinated by CVS on January 2nd, but there are 7 total. So 6 more centers of veterans were left unvaccinated. And last week, Keith Reed, a commissioner over at the state health department, told me they were tired of waiting. They felt like these veterans needed this vaccine ASAP, and they had the resources to do it.
So what exactly do you think went wrong here in Oklahoma, and will we continue to see these public-private partnerships going forward?
It's a difficult process. It's very resource intensive. Thousands of employees, thousands of residents. It's a big lift. So he told me that while he felt like the state could get those vaccinations quickly to the veteran centers, he also said, CVS and Walgreens are doing their best here.
What have you learned about the patients and employees themselves? Do they appear to be embracing getting the vaccine, or is there still some resistance to that?
Some facilities I've personally spoken to have had a really good turnout in terms of residents and workers who want the vaccine, who really feel like this is what they need to get their facilities back to normal, to get visitors back in, to get group activities going again, and really just to protect residents and save lives. Others are a lot more skeptical. They are mistrusting of this vaccine that was rushed through the FDA approval process. They're concerned about long-term symptoms, that they may have some sort of reaction. So I definitely saw a lot of folks who were hesitant. There's a lot of workers who've decided that they're going to wait and turn down the vaccine on the very first rollout.
I'm surprised they would be reluctant to get the vaccine because our senior care facilities, VA centers, some of the hardest hit by coronavirus, aren't they?
There were 74 deaths, that's among staff and residents, just at the veteran centers. Now, across the entire state, there have been more than 10,000 infections of coronavirus, and we had 813 deaths in those facilities statewide. And of course, we can't forget the family members of folks who live in these facilities who, in many cases, haven't seen their loved ones in months.
Whitney, those are some very sobering numbers. Once again, your reporting is excellent. Thank you very much.
Thanks for having me on, Rich. We appreciate it.